Hi, welcome back to Colorado and Company. Well, slowing the aging process is a daily goal for many of us. Yeah, me too. The wrinkles add character lines and your skin takes on the effects of our Colorado sun. But staying young starts from within, and LexiLife health clinics are dedicated to improving people's lives through preventative care.
LexiLife uses advanced technologies and techniques to optimize your physical and mental health and performance before you get sick. Dr. Alexis Parker is from the LexiLife Health Clinic right here in Denver, Colorado. And welcome back to the show. It's great to see you.
Thanks. It's great to be here again.
You know, and Dr. Parker, you have such a diverse background, and why don't you give us a little glimpse into your credentials and experience?
Well, I went into medicine because I wanted a lifetime of learning, and I think that I've really attained that goal and continue to attain it. I started out in general surgery. I did residencies in general surgery and plastic surgery, and then actually practiced emergency medicine and boarded in emergency medicine. I practiced emergency medicine for 16 years, and after that started doing laser medicine and non-invasive cosmetic dermatology. But during that period of time, I was always interested in wellness and really taking care of myself and my family and my friends really from the inside out as well as looking good on the outside. I started a wellness clinic in Florida in 1991, and at that time all we had were vitamins and lifestyle programs, exercise, and glycolic acid. But since that time, bioidentical hormones have really our understanding of bioidentical hormones, our understanding of biochemistry, our understanding of really the application of biochemical standards to healthcare and prevention of disease has advanced tremendously.
Okay, well, let's dig a little deeper there. You obviously have quite a resume and the knowledge about hormonal treatment. So explain to us the differences between bioidentical hormones and then the synthetic hormones.
Bioidentical hormones 10 or 15 years ago were called natural hormones. And they are hormones that are made either from yam or soy. In a laboratory, they are altered to exactly match the human hormone. So we can actually match human estradiol, human estriol, which are female estrogens, and we can match progesterone. In traditional medicine, we've always used medications that were patented that fit the receptor, like a key fits in a lock, but they didn't match exactly. So what the non-bioidentical hormones do, or synthetic hormones do, is they mask the symptoms, but they don't really have all of the activities in the human body that a bioidentical hormone has.
Okay. All right. Now, sometimes people hear some negative press about hormones. So what is your response and the impression that you get from friends?
Most of the negative press about hormones has been about synthetic hormones.
Okay.
Synthetic hormones include things like Prempro. The Women's Health Initiative study was done with Prempro, which is a combination of Premarin and medroxyprogesterone. These are synthetic hormones. The key fits in the lock, but it doesn't match exactly. It's the skeleton key.
Okay.
So it's not going to have all the effects on the body, the good effects that natural or bioidentical hormones have.
Makes sense.
Got it.
Yeah.
Okay, let's go to your practice now, LexiLife. Tell us a little bit about your practice and why is it so different than from my family doctor?
Well, your family doctor, you go to your family doctor for some preventative things, your shots, your annual, physical exams, your colds, your flus, your things when you don't feel good. Most people go to the doctor when they don't feel well. What I do is I try to identify not only your genetic predisposition, but what your lifestyle is leading to, and early markers of disease. For example, there's a lot of cardiovascular disease in women that goes unidentified because women don't have their cholesterol and their lipid profiles done early. And there are studies now that say we should be doing it when people are in their 20s.
Yeah. How can you tell when your hormones are unbalanced? What are the signals we might see?
When's the last time you sat on the couch feeling grumpy?
Yesterday afternoon.
You didn't get those rocking
You can,
tickets.
for women, menopause, actually these are the pauses in life. We call them andropause and menopause. And what happens with women is that sometimes the symptoms are insidious. You know, they happen, they go over a course of about 10 years.
Yeah.
And maybe 20 years for men.
My
So
goodness.
in women, you may have a little depression in your mid-30s. Your libido may fall off a little bit. Libido drops with the birth of every child because testosterone levels drop coincidentally. Libido will also drop in a woman who's on birth control pills. The second thing that may happen is that you can't sleep quite as well at night because your progesterone is low.
Those are difficult signs, but I mean, let's talk about age. What age should a woman just go get checked out?
A woman should get checked out. First of all, you need to have your thyroid checked in your early 30s. Or if you have any symptoms of weight gain that's difficult to lose, symptoms of sleeplessness, or even depression is often hormonal, especially when it follows the birth of a child.
Yeah. Hormone replacement therapy is big these days. Are there any misconceptions out there that we should know about?
Well, there are misconceptions. There are, first of all, you don't replace a hormone unless you test, okay? You test for hormone levels. You listen to a patient. I spend a lot of time with my patients on their first visit. And I look I listen to their complaints about their hot flashes, loss of energy, inability to sleep. Just a lot of things. One of the things I hear most commonly from men and women is, I just don't have the energy that I had before. I can't do what I used to do.
So many people are
And
struggling.
in medicine, we used to think, oh, we can't do anything about that.
Yeah.
You know, that's kind of what I was taught.
Yeah.
But now I understand that that's truly a symptom.
Okay, well, let's talk about the seminar that you have coming up then, because there's a lot of viewers probably relating to what you've just talked about. It's November 14th. What will we hear and learn?
On November 14th, we're going to talk about menopause, which really can start in the early to mid-30s. Progesterone levels drop in the mid-30s. As I said, they can drop after pregnancy. But the hot flashes, the insomnia, the night sweats, and all of those things may hit later. But we're going to explain how the whole course of menopause works and how you can address it early on.
It's really going to pay off to go there because there's a lot of
so much.
information that needs to be learned. Nice seeing you again.
Nice to see you. Thanks for inviting me.
All right. And there is nothing you can do about your chronological age, but listen, your biological age, that's a different story. Improve your life quality and longevity with LexiLife. Go ahead and give them a call at 303-782-5026. That number is 303-782-5026. You can also go online to LexiLife.com. If you call and mention Colorado and Company, LexiLife will provide a free health consultation with Dr. Parker. That's a $125 value, and you'll receive 10% off their lab fees when you sign up for a treatment program.
You can attend a free seminar on Wednesday, November 14th at 6777 East Hamden Avenue. Learn about how to deal with menopause. It begins at 6:30 in the evening. You can RSVP by calling LexiLife at 303-782-5026. LexiLife paid for this segment.